ITP is actually what we call an autoimmune disease. And what this means is that, our immune system, instead of attacking invading cells, protecting us from bacteria, protecting us from viruses, for, some not always understood reasons, starts to recognize some of our own healthy cells as being foreign or as being invaders, and our immune system mistakenly starts to focus on and destroy those cells. In the case of ITP, it's the platelets that are being destroyed. So bleeding symptoms of ITP include, easy or what we would term unprovoked bruising. When we say unprovoked, we are really just referring to bruises that occur without any injury or trauma that was noted by a patient. Patients may also come in complaining of what they call a rash. Oftentimes, what's actually causing this rash are these little pinpoint areas of bleeding that form red dots in the skin. These are what we in the medical world refer to as petechiae. Oftentimes we will see this, what we will sometimes call a petechial rash on the lower extremities. But rather than being a rash, again, these are actually little pinpoint spots of bleeding on the surface of the skin that commonly are experienced by patients with ITP. And then finally, patients may experience really bothersome symptoms, things that include nosebleeds that may be very difficult to stop. Patients who are having periods may also have very heavy and prolonged periods, passing large clots. And we can also see patients having bleeding gums that occur either spontaneously or when they're brushing their teeth or flossing. This study really was a large study. It surveyed 1,500 patients with ITP kind of from across the globe. They certainly highlighted that they had sort of reduced energy levels that sometimes were limiting, again, the activities that they wanted to do during their day. Patients also reported difficulty concentrating, and this really kind of spilled over into even a limited ability to complete daily tasks. This, unfortunately, it translated into decreases in productivity, and the anxiety revealed to be a prominent part of the lives of these 1,500 individuals with ITP as well. I think it's really important that we take this information into account and understand that ITP is not a disease that just is about the platelet. Of course, platelets and bleeding risk, and sometimes even the risk of forming blood clots, are absolutely key components of this disease. But I think that the IWISH study really highlights the fatigue, the difficulty concentrating, and also a lot of the aspects of anxiety that surround this disease.